Welcome to Washington Watch with Congressman Walter Jones. Each month, we take a look at the events happening in Washington, D.C. and how they affect our lives here in eastern North Carolina. And now, here's your Congressman, Walter Jones.
Welcome to the January edition of Washington Watch. I'm pleased today to have as our guest Congresswoman Renee Ellmers, who just recently was elected to represent the 2nd Congressional District of North Carolina. Renee Ellmers and her husband Brent live in Johnston County.
Harnett County.
Harnett County. Well, I should have done better than that. I apologize. And she and her husband Brent have a son, and Brent is a doctor, and Renee has been, until she became a congresswoman, an RN, a registered nurse. And today I'm delighted to have Renee because I thought I was in 1994 part of the largest class in many, many years. But Renee and her fellow Republican freshmen, they are the largest class in many, many years. So I'm delighted to have you on the show today, Renee, and I had the pleasure of meeting Brent and your son. And how do you feel as a new member of the United States Congress?
Well,
2 weeks now or 3 weeks?
I think we're going into our 3rd week. It's
Okay.
a little like starting college. It is very much, when we say freshman, we really mean freshmen. So there's a lot to learn. Every day is filled with new things that I'm learning. It's very exciting. I'm trying to learn everyone's name, but there's lots of faces, lots of names, lots of people, and it's just very exciting.
Well, tell me the committees that you've been assigned to.
Agriculture and
good.
Foreign Affairs and
Splendid.
Small Business. And I have been honored with the opportunity to be the subcommittee chair for the health care subcommittee on the small business.
Splendid.
So I'm very excited about that.
Well, Renee, that brings me to our first question. With your husband being a surgeon, I believe, share with the people watching this show why you and I believe that we need to repeal the Obama health care bill. And you've made some very, very strong points. You are, as your husband Brent and myself, we believe in health care reform, but not this way. Will you expand on that?
Absolutely, and that is the important thing to remember when we keep in mind that we want to repeal Obamacare, but we need to replace it with good, common sense, patient-centered solutions. We've got to keep the patient relationship between the doctor and the patient, and with this bill that we are repealing and will be voting on later, it just has too much government control. There's too much regulation. There's too many mandates. We're already seeing too much of an effect in the healthcare field right now. We have doctors who are retiring early. We have doctors who aren't taking Medicare patients anymore. We have doctors who are closing their doors. Hospitals are buying up practices. It's not a good thing that we're seeing right now. Plus, private insurance costs are going up. They're skyrocketing, basically to adhere to the mandates that Obamacare calls for. So it's hurting us as we speak now, and it isn't even in effect until 2014. So the idea being, let's just start with a clean slate. Let's get the reforms that we need in place in order to make health care affordable for everyone.
Well, share with the viewers, because I think I know the majority of people in the 2nd District probably feel the way those in the 3rd District. That is that they want to see a common sense approach. And we know it's a very complex issue. You've already touched on that. But some of the aspects what would you say are the 3 most serious issues facing the average citizen of the 2nd or 3rd District, or anybody across this nation, as it relates to what needs to be achieved to improve their health care opportunities?
Well, basically, I'll start with one of the simplest issues. There's $500 billion cut out of Medicare, and yet they say that we're going to be saving and that no benefits will be denied any Medicare patient. Well, basically that just, the average person knows that that is not a possibility. You can't have a cut that large and yet increase your services. So that's a big issue right there. We've got to make sure that we're preserving Medicare for our seniors, and that's by putting things in place to make it more affordable, to do things that are going to ensure that care is received to our seniors. The other thing is it's such an effect to our small businesses. Our small businesses cannot afford what they're asking us to do, and that is forcing employees to end up on the exchange program or into Medicaid, and that's just going to, across the board, increase costs for everyone. There are projections that basically over time there's going to be a decrease in Medicare payments or reimbursements to physicians and hospitals over a period of time. By 2020, they'll be paying about the same that Medicaid is paying right now, which is minimal. So it's hurting businesses across the board. Then there's the issue of life, and they were going to leave out any bits of legislation that would help or aid in abortion, and there's legislation. It's part of it, and a 2,400-page bill is just massive, and it will grow the size of government by leaps and bounds. And we have to stop it now, again, to put those common sense solutions in place.
Well, thank you for sharing your thoughts on health care, because again, we've all said, I've said many times, I'm for health care reform, but I want to see it done in steps. I want to see it done with a great deal of thought and what's in the best interest of the people that would benefit from health care reform. And like you and most of the Republicans, maybe all the Republicans today, and there'll be a few Democrats when we vote, I think, to repeal the Obamacare, and then will you explain, because you said you were subcommittee chairman on health care and the small business. Now, what is going to be the idea of we're going to replace? Our party has been saying repeal and replace. Will you share your thoughts about replacement as to how the committees will come together, not necessarily all the issues?
Well, there are so many different pieces and parts to the bill that's there right now. One being the 1099, having to file the 1099 form for any purchase of $600 or more for any business, basically. That is going to increase the cost of doing business incredibly. That is just a cost that we cannot afford. So that's going to be one issue that I know the Small Business Committee, now whether that's in my committee per se or in another, we will be addressing that. But, not knowing whether the repeal will go through, not knowing whether it'll go through the Senate and make it to the President's desk. He has the ability to veto it, of course. So there are other ways that we can go about taking it apart. If you take one piece of the Obamacare bill apart, the whole thing falls apart. So those are some of the ways that we are going to be looking at it. Now, the thing is the replacement issues are pretty simple. And those of us that have been in healthcare have known that these things need to be in place for a long time. And if there's a silver lining to this healthcare reform bill that was passed, it's that now we have the ear of the American people. They understand how important it is and how much we need to address it. We need to bring costs of insurance down. We need to bring healthcare costs down. And those are two similar pieces that fit together. They're not one. They're two separate issues, but they exist in conjunction with each other. So if we can do things like tort reform for our practicing physicians. Physicians practice defensive medicine every day. Hospitals, emergency rooms, physicians in their offices. We order way too many tests. We don't need them. These things can be diagnosed without, but we do it so that we can protect ourselves because of the chance of a lawsuit. So when we talk about tort reform, that's what we're referring to. We should be able to buy insurance across state lines. If you can buy car insurance online in California and you're living in North Carolina, why shouldn't you be able to buy your health care insurance that way? There's an element of personal responsibility that I think we've got to instill. people need to be responsible for themselves and their families, and if we can bring those costs down, then we can eliminate things like pre-existing conditions that you hear so much about, because once everyone's on health care coverage, that becomes a non-issue.
Renee, let me switch gears for just a moment, but it is tied into the health care debate. Many of us for the last few years, really going back to the previous administration, have been concerned about the growing debt of this nation. You and many of your freshman colleagues, I know, campaigned. These were issues that you, along with health care, debated in your district when you challenged for the seat that you won. I know that soon we're going to have to raise the debt of this nation. I don't think I voted but one time in 15 years, which is 8 terms. I don't think I voted but maybe one time to raise the debt ceiling. And there's been criticism by the media that, well, now that you're in charge, you're going to have to bite the bullet and raise the debt ceiling. What are your thoughts on that issue?
Well, it is definitely, now that we're all pretty resolved to repealing Obamacare, now we're turning our minds and our hearts to that issue. And it's difficult for a lot of us, especially a lot of us, freshmen, because, none of it, we all ran on tax cuts, repealing Obamacare, and making business more, available in this country, bringing jobs, creating jobs in the private sector. So when we talk about raising the debt ceiling, unfortunately, this is falling, we're telling the American people, we're going to have to raise the debt ceiling or tomorrow won't come. And that's what we heard with TARP. That's what we heard with the stimulus plan. So I think what we really need to do, we need to take a good, long, hard look at it. And we need to remember that if in fact the debt ceiling is increased, it's because of the bills that unfortunately have been racked up by President Obama and his administration, for one. And if we do, it's so that we can preserve things like those Social Security payments to our seniors, and making sure that we can continue to pay for Medicare, all these things. But it has to be coupled with some significant tax cuts. I don't think a straight up or down vote on increasing the debt ceiling is going to fly for most people. I think we are going to have to see some serious cuts in spending, tax cuts, and then it'll be a little bit more palatable.
Well, how many colleagues do you have in the freshman class? Because I forgot the number.
There are 87 altogether.
That's quite a voting block. If they choose to be a voting block, they can just about stop anything that's coming down the railroad, so to speak. I know that you and your colleagues had the honor and the privilege, and it's a humbling experience, to visit Walter Reed recently.
Yes.
Would you share, because of the being new in the House, and share your feelings about what you saw and the kids that you talked to?
Well, I'll tell you, it was a very emotional day. Many of us went, especially as freshmen. There were a large group of us that really wanted to go over to Walter Reed. We were able to do that last week. And it was amazing in the sense of what they're doing there. And I mean, from a healthcare perspective, their approach, using basically sports medicine to heal these, they're young people. The typical amputee patient is an elderly person, maybe with diabetes, where they're at the end of their life, they're not as mobile. These are young kids that are losing one leg, 2 legs, maybe an arm, maybe more. And so their approach that they're taking is amazing. I was inspired. It was very difficult to see, but after talking with them, after talking with their families, it's amazing. They want to turn this bad situation into a very positive one for the future. It's very unfortunate. It's terrible to see these kids. It just goes to show you the devastation of war and the effects on all of us.
Renee, I'll tell you a quick story. We've got about 5 minutes. That when I went 2 weeks ago and saw the kid that I know you saw and your colleagues saw, the young man who's lost all of his body below his waist, and I found out that he was a big fan of the Green Bay Packers. So it just so happened the next night at a home health reception at the Capitol Hill Club, I ran into Rich Ribble. And I don't know how we got on the subject, it doesn't really matter. But I told him about the visit, and he said, well, we're going to visit in a couple of weeks, and do you think he would like to have an NFL football signed by a Green Bay Packer? And I said, I think he'd be thrilled to death. So, Rich, I know you were there, I believe, when he presented the football, but I knew that, and he gave the football to the young man I just described that's lost below his waist, everything. But, yeah, it is, I wish, truthfully, that more people could see the cost of war. You know, we think about those who gave their life for this country, but I think constantly, and I'm sure that you do, of these wounded, particularly those that have lost parts of their body, that they're the veterans of 20, 25, 30 years down the road. I won't be here and probably not even living, but the point is we got to make sure that there's going to be, Uncle Sam's going to be able to write the checks to them because they've earned it.
Absolutely. They themselves, their families have sacrificed so much. We're lucky that there's those boys, and I did not meet any women that were
girls that have
injured.
lost body parts too.
But those family members, you know, as one of the wives had said, hey, my baby has a father, I have a husband, and it's, you know, we're just excited about that. So, but we need to take care of them. We need to make sure that everything that can possibly be done. And I will say that Walter Reed is doing everything at their cutting edge to help these kids.
Well, I hope in time that you and your colleagues will have a chance to go to Bethesda. In fact, I was there yesterday. There are about 17 Marines from Camp Lejeune who have been wounded. We saw a few yesterday, maybe 6, 7, or 8. But again, as we got a couple of minutes left, I want to go back to being a freshman. There's one thing about it that you can certainly make a comment on. It's on-the-job training. I mean, they'll give you the book, they'll give you the direction, they'll tell you the committees, and then it's up to you to get on the train, so to speak.
It is very exciting. In fact, today there was a Foreign Affairs hearing, and I had the opportunity to ask a question. And I'm still at that point where I'm still thinking to myself, I can't believe I'm sitting in this chair right here in this room, where as if not just watching it on TV, you know. So there's still an element of surreal thinking to it. I guess over time I'll get used to it. I was able to read part of the Constitution on the House floor.
Oh, good.
And I did get a minute to talk about health care last evening. So I'm getting used to that, and I guess it'll just grow on me. But it is very exciting to be here. It's very exciting, and I'm very honored to have, you know, been elected to represent the people of District 2.
Well, I think the people of Congressional District 2 are going to be very pleased with your leadership. And like you said, you've jumped right in there and got your feet wet. And that's really the way you have to do it up here. And everybody's very friendly and get along, even though we might disagree on issues with the other side. They're good people on the other side as well. And I'm just delighted that you will be a leader in the freshman class, but also as you continue to serve. And I know you've learned one thing that we've all learned. You go back every weekend so that people will know that you didn't forget them.
That's right, and that is my plan. My plan is to go back as often as I can. And of course, the first week in February, we'll be back in our districts, and I'm looking forward to that. And I want the people back home to know that I am that they are my thought. They are my special interest. They are what I am here for, and that anytime they need to reach out to myself or our offices, whether it be here in D.C. or back home in the district, please feel free. That's what I'm here for.
Well, how about giving some of the people watching this show will probably do live in your district. How's the best way they could communicate with you, by telephone or email?
I think well, actually either one. They can go on our website or they can call our district office, and don't have the number off my hand.
Oh,
I don't even have them memorized yet. But certainly they can call here to DC again, or contact our district office. Email is wonderful. You know, we've got that line open, and you know, we need to hear the thoughts of the people, especially on all of these issues.
Renee, thank you for being on the show today. In a few minutes, I'm going to have Glenn Down, my chief staff, to come on board. But you've been a great guest, and you're going to be a great congresswoman. And thank you for taking your time today to be on the show. And just about 1 minute, Glenn Downs is going to be on the show. We're going to talk about some issues that you've called about, and thank you.
Thank you.
Welcome to the second part of the January edition of Washington Watch. Glenn Downs, I really enjoyed having Renee Ellmers on. She's a delightful person, and I can tell the people of her district she's going to work as hard as she can to do what's right for the people.
Well, thank you once again for having me back and the opportunity to give voice to some of the people that have called into your office and had some questions, concerns, and thoughts about the new Congress. And one of the things that people have asked about is some of the things that you just asked her about, is what's new for Walter Jones in this new 112th Congress. You're still, what are the committees that you're on?
I will be back on the Armed Services Committee, which I've been on for, this will be my 9th term. I will be also on the Financial Services Committee, chaired by Spencer Backus. That is a committee I'm really excited this year because I'll be on the subcommittee with Ron Paul. He'll be the chairman, I'll be the vice chairman, and we're going to look into the Federal Reserve. So that's going to be a real interesting committee to be on.
Well, let's talk about that real quickly, because you are on 2 subcommittees on that Financial Services Committee. Right. The Financial Institutions Subcommittee, which regulates banks and other financial institutions, but then also this Domestic Monetary Policy Committee, and you're going to be the vice chairman of that subcommittee.
Well, you know, Ron Paul has been an advocate of auditing the Federal Reserve, and I've been on his bills to audit the Federal Reserve. And so we're going to be very busy, very active, and thanks to you and Josh Bolin, I was able to write a letter to the new chairman, Ron Paul, to ask for a hearing to see how the monetary policies of this country are impacting on our everyday life of buying gas at gas filling stations, buying food. So it's going to be a very active committee, and I'm delighted to be on it. I thank the people for the opportunity to serve them.
Well, that's one of the things that people are expressing a lot of concern about, that you've had the Federal Reserve talking about they're doing this quantitative easing, a lot of money printing, and they say they're trying to fight deflation, and the people that are calling your office are saying, what deflation? Congresswoman Ellmers just mentioned insurance costs going up.
Right.
People talking about going to the grocery store and they don't see deflation. Then they go to the gasoline pump and they don't see deflation. They see the Federal Reserve printing money, and they see the prices that they pay on an everyday basis going up. And they want to know, is anybody here tuned into this? So it sounds like you've
thank you for you and Josh and I talked about this and felt the need to ask for a hearing. And I'm of the belief that Ron Paul will probably give us a hearing on this issue sometime this spring. It won't be right away, but sometime this spring.
On the other committee that you're a member of, the the Armed Services Committee. You are a member of the Tactical Air and Land Subcommittee, which is sort of a new subcommittee configuration as I understand it, and then also the Personnel Subcommittee. So we've got the big lot of military presence in Eastern North Carolina. Can you talk about those two subcommittees and why they are important to people in Eastern North Carolina?
Well, Glenn, both of them do have an impact on the bases and the people on the bases, our military personnel. And I think it's important because this year we're going to have to see every committee is going to be responsible for analyzing what we need to have that's in the best interest of the men and women in the uniform, but also to the public, because our country's in bad financial shape. We know that we owe the Chinese over $900 billion. We know recently when Secretary Gates went to China, I don't think the Chinese, they were cordial, but I don't think they really cared much about what our Secretary of Defense was saying to them. So I think it's important that to be on these committees, because we're going to have some real difficult decisions to make about the future.
Well, people that have called your office have expressed two thoughts which are almost contradictory in a way. One is that they want to see benefits that they've come to count on or come to expect, like their Social Security benefits, to be preserved, and at the same time they're concerned about the debt and the deficits and trying to control those. And that's a pretty tough balance to strike. You asked Congresswoman Ellmers about this upcoming debt ceiling vote, and what are your thoughts on that?
Well, I agree with the Congresswoman for this reason. You give me an alternative that I can believe in and trust to show that we are serious about bringing this debt and deficit down. Don't just ask members of Congress to vote to raise the debt ceiling, because we've seen what's happened in the past. That just allows this country to borrow more money from foreign governments. I think both House and Senate, I think truthfully that we are ready, both parties, I want to be fair about it, both parties are ready to deal with the fact that we are in deep financial trouble as a country. And to raise the debt ceiling for the sake of raising the debt ceiling just allows the government to borrow more money. We want to make sure that if that should be the decision, and I haven't made up my mind yet, my gut feeling is I won't vote for it, but we want to make sure that if we're going to give you raise this debt ceiling, that you're going to do something on this side to bring down spending. That's what's got to take place.
So far, have those conversations, but from anybody, other than conceptually, in terms of hard proposals, has the administration or anybody else come and said, hey, here's our proposal? Not yet. They say the vote will probably come in March. So I got a feeling that February there's going to be a lot of discussion about what are going to be the alternatives. Don't just say you've got to raise the debt ceiling. Tell me what you're going to do to bring down the spending. So I think that's on the way, really. Glenn, we've got just a few seconds left, as always. I think maybe we should make this a program for 30 minutes in the future. But I want to say to those of you that are watching this show, thank you for your support, your friendship through the years. Our office door is always open. We're willing to talk to you on any issue, whether you agree with us or disagree. But we feel like we're listening to the people of the 3rd District, and that's very important to do a good job, not only for the 3rd District, but our state and our nation. I want to say again that I appreciate Renee Ellmers being on the show, Congresswoman, my Chief of Staff, Glenn Downs. And I want to say to those of you watching this show, pray for our men and women in uniform, that they will be safe. And I will say in close, ask God to continue to bless America. We need the blessings of our Lord and Savior for the good of our children and our children's future. Thank you for watching.
Thank you for taking the time to join us for Washington Watch.